I had no idea that I'd ever be teaching technique. This was totally accidental to me, and it occurred because I was in horrible pain. I was in a bad accident. It wasn't a car accident. I had been hit in the head by a piece of furniture that was laid on its side when we moved into our house. I closed the door, big piece of laminate furniture, about 7 feet tall, weighed a few hundred pounds, very sharp edges. So it was on its side. I closed the door, and it fell. Just toppled over on top of me. I was totally blindsided. I had a concussion, and I almost lost my 3 fingers. There's still scars on it. Fortunately, my head was in the way, so that stopped and I would have lost those fingers. The cuts went very deep. So, you know, when you have a concussion, you go to bed about 4 o'clock in the afternoon, and you sleep, and you don't feel right. And within a few days, I lost use of my hands. I remember Seth was an infant then. You know, you pick up babies. I couldn't pick them up. To make operating scissors was impossible. And I started getting a lot of work done on me, and it seemed to go away, and then it came back with a vengeance. Everybody worked on me. I know well, at the same time, I'd had about a 20, 25 year, actually 25, 30 year lumbosacral disc problem that had been getting worse. And, you know, the worst thing in the world is not to have a problem. The worst thing is for it to be getting worse, and you don't know what to do, and you're watching yourself get worse. Hopelessness or helplessness is the worst emotion. They say it's worse than depression. And I was feeling a sense of helplessness, watching my body deteriorate on a regular, and I'm getting adjusted constantly. Well, I figured the adjusters in my area weren't helping, and so I decided to travel around the United States, and I went to just about every technique. I had people work on me, the top names, and I didn't get any lasting relief from any of them. And then I was going to physical therapists, osteopaths, craniosacral therapy, body work, medical doctors even. You know, when you're desperate, you'll do anything. And I traveled all around getting work done. Acupuncture, too. Had one acupuncture. A very nice lady from China. She was not far from where we live. So I went to her, and she looked at me, you know, stick out your tongue. And I like acupuncture a lot. I like Chinese medicine. And I asked her, what do I have? You know, tell me what's going on. And she said, you have arthritis. I said, I don't have arthritis. You know, in that system, you never question the doctors. But I was not going to play games. I don't have arthritis. I said, can you give me a Chinese diagnosis? So she said something in Chinese. I figured my triple heater is off, you know. My meridians are out of balance, something. I said, oh, great. What does that mean in English? She said, it means you have arthritis. Helplessness continued. And I was getting really bad. There were days that I couldn't walk more than 10 feet without the sciatica getting so bad I had to sit down, or I'd go into a crouch. Middle of a city. The family's walking. I just have to, and after about a minute or two, I seemed fine. I'd get up and I could walk 10 more feet. And it was getting real bad. My hands were constantly fat. They felt fat, like large rubber bands were around my wrists. And they started breaking. And it started bleeding. There were days I'd bleed on patients, and that's how bad it was. I was in Florida with the family, and we ran into, I was desperate. And I remembered we were on Key Biscayne, and Alan Creed, who is yet to take a seminar, and he promises he will. So Alan practices on Key Biscayne, and we came to see him, and I was desperate. And he used all these gadgets on me, and something he did took the edge off. No one had ever been able to do that before. So when we got home, I just ordered everything he had. And it was shipped up, and I started experimenting with it. And it was accidental. But I realized if I combined things from DNFT, Directional Non-Force Technique of Van Rump, and Stressology, which was developed by Lowell Ward, which not many people know of, using adjusting instruments, I could adjust myself specifically. And I knew if I was out, where I was out, and if I fixed it. Now, I'd always done like diversified and all the cracking and popping. You never really knew if you got it or didn't get it. I mean, it sounded nice. It's very satisfying to the doctor to hear all those noises. But if you didn't get the noise, you try it a little harder. And it was hard on the patient. But, you know, action, reaction, any force comes back at you. It was hard on the doctor. I know 4 doctors in my area that had surgery from adjusting. Arm, shoulder surgery, hip surgery, whatever. And I suddenly realized, wow, I can work on myself. So I started working on myself. And Beth was a little surprised because she heard the arthrostim instrument going. She looked outside and there were no cars in the driveway. She says, what is he doing with this thing? And within about a week, my 6.5-year hand problem disappeared. And it took me about 6 weeks to clear up my 25, 30-year lumbosacral disc problem. Would have taken 3 weeks, but I didn't know what the hell I was doing. I was experimenting on myself. Beth had migraines monthly, sometimes weekly. You know what it's like when you can't help a loved one? You know, it's horrible. Here I am, I'm adjusting her, and the migraines are going, and she'd throw up, and she'd have to take something. So I ran upstairs to the bedroom, you know, with the instrument. Dad, you got to see this. And I checked her, and I found the sphenoid out, and I adjusted it, and that was about 3 years ago, and she hasn't had a migraine since. And these kind of stories, I said, well, is this going to only work, actually? Is this technique only good for chiropractors that write patient education literature? It might be a very small population that this works on. You know, n equals 1, maybe, and my wife, n equals 2. Or will this work? So I wanted to find the most difficult patients in the world, who were, of course, chiropractors, who had been adjusted hundreds of times using different techniques and were still a mess. So when I'd go to my seminars, you know, my regular seminars with philosophy and research and vaccination and the connections of health and the stuff that I've done for many years, speaking on, I would make an announcement right before the break. So anyone here who has a chronic problem, you've been adjusted for years, you're still not well, see me during the break. And I dismiss them. I figured 1 or 2 guys would show up. The line went out the door. These are chiropractors. I said, our profession is in trouble if we're all sick and we're getting adjusted. And doctors would confide in me, and they'd say, you know, some days I'm in more pain than my patients. So I said, there's something serious. The profession is subluxated. There's something seriously wrong. And I began working on these people, and the responses were incredible. And I began to realize I really have something. And people would say, when are you teaching us? And I'd say, I'm not. And they'd get upset, but I didn't feel ready. And for about over a year and a half, I went around the country and started just adjusting doctors at seminars. You know, just saying this, I found something new, I'd like to try it on you. And then one day, I was lecturing in England for the McTimoney School there in Oxford. And they gave me 16 hours to talk, 2 days. The Europeans don't have this half-day Sunday thing. They just do both full days. So I thought, what the hell? I've got a little extra time. Let me show everybody some of the things. I spent a couple of hours giving them the basics. And I started getting emails from people a few weeks later about all these miracles that were happening in their practice. So I said, okay, I think we're ready to start teaching. So in May of 2005, we gave our first seminar, and we haven't looked back since. This work is based on really one thing only, and that's results. It's, I can give you all these theories and everything. What really matters is, can you get yourself better? Can you adjust your patients and get results like you've never seen before in your life? And that's what we're going for. It's from, as I said, directional non-force technique, DNFT, spinal column stressology, and the arthrostim. Anybody knows these techniques, you'll very quickly see where I got inspired from. Also, a number of other people were very instrumental, and in the book there's an acknowledgement section. And in addition, there's also and I started reading technique books. I never really was that interested in technique before. Suddenly it became personal. So I started reading stuff from Desjardins and Goodhart and others, and I began to see how, and I sort of rediscovered stuff that they discovered. So I knew I was on the right track if I was rediscovering their stuff. And also I was sort of rediscovering a lot of Van Rump stuff. We had a real problem figuring out a name for this technique. First I thought DNF Ted would have a ring to it. Gonstead sounded good because that name was already known. I thought just add an extra D and we're all... But then somebody said something about lawyers and we backed away from that. Totally Effective Disharmony Destroyer is what my wife thought was a nice name because it spells out Ted. A synchronous hand instrument technique I came up with until we figured out what the initials spelled. So we didn't think that that would fly too well. Although one state approved it under that name. It's like nobody figured out the... and chiropractic reductionistic adjusting protocol also couldn't work because it's not reductionistic. So let me move some of these away right now. So anyway, so we thought Koren specific because people know my name in the profession. So the benefits are you can accurately, efficiently, and quickly analyze and correct subluxations anywhere in the body. Spinal column, skull, pectoral girdle, pelvic girdle, ribs, sternum, extremities, anywhere. Now, coming from Sherman, that was like, you know, heresy, because I was taught upper cervical. You know, BJ was worshipped for his technique, among other things. So this was a really big jump for me. And the reason why I acknowledge upper cervical work, and I like it a lot, and it's very important. The reason why we moved to a different view was because in this work you ask the body. So I figure the body knows more than me. Innate knows more than the doctor. You know, here we are telling people, well, innate has to do this. Innate says only adjust the spine. And innate doesn't say that because we're asking the wisdom. We access the wisdom of the body with this work. And if the body says go here, you go there. So I decided I'd humble myself before the wisdom of the body and follow where it led. And it will take you to really great places. With this work, you will become a detective. This is no technique where, well, if a person has this, you do that, and a person has this, you do that. This is not like that. We give you a protocol, and you become a detective and discover it. Everyone is totally unique. You know, 1,000 people with migraines may have 1,000 ways it's what's causing it. And you can ask the body and find that their unique stress, subluxation, and environmental patterns that are creating the problem and release it. So this is the cool thing about this work. One thing that told me that I was onto something was that I was seeing retracing. We have a brochure on retracing, and I think it's in the book, a little article on retracing. Retracing is the only real measure of healing. It means old injuries are coming to the surface, old stresses, and it can be physical or emotional. When things come out, and in my lecture, Connections of Health, I get into retracing more, but this is the only real measure of healing. If you're not getting retracing, you're not really getting healing. And of course we discuss it in chiropractic. In homeopathy, they call it the law of cure. It's been referred to as Herring's law, and it's been known, you know, for millennia as the way the body heals. Old symptoms come out. It might come out in dreams, might come out emotionally in front of a person, might come out as physical symptoms, but there's a release. And that's what really told me I was onto something, because I did not want to discover a glorified aspirin. Now, for too many of us, too many of our patients, that's all chiropractic is, a glorified way of getting rid of pain. And that's not what it really is. We want to really heal people from the inside out and make them whole and healthy. You want to adjust people, and you won't see those subluxations again. Their subluxations heal. Because you can lay a person down, and you know, I come from that diversified background also. I know I can lay them down 3 times a week and crack their backs every time for years. And maybe we have patients like that. They don't really heal. You're releasing stress patterns, you're cracking them, and then they get it all over again. With this work, you adjust them, and you won't see the same subluxations again. They will actually be better. And after a while, they'll be clear. And this is the beauty of our work. And the great thing about it is you could do it to yourself. That's the real cool thing. I mean, what's it worth to be able to adjust yourself and keep yourself clear the rest of your life and your family? So that's part of the beauty of this. And to me, it was personal. That's why I was so excited. Now, it's possible to check and adjust a patient in any position, standing, sitting, laying down, or especially in the position of dysfunction, injury, pain, position of subluxation. You want to bring out the subluxation. And subluxations are posture specific. In other words, a person who was in a car accident and got a whiplash, just to use a crude example, they are best adjusted or checked sitting, because they were sitting when they got the car accident. The damage happened in the sitting posture. And Dr. Ward discovered this. You can have somebody standing, take an x-ray, they look fine. Sitting, they're a mess, because subluxations are posture specific. And by posture, we don't only mean physical posture. It's emotional as well. You know, the word posture can mean an emotional or a physical state, and that is perfectly applicable to this. I mean, you adjust somebody, that you clear them out, and they think of their ex as they're walking into their car in the driveway, and suddenly they're all subluxated again. Well, what do? Well, you check them while they're thinking of their ex, and you adjust them when they're in that state. You can actually check and adjust people when they're thinking of their serious, most severe emotional stuff. You can adjust somebody laying down, but if standing is when they have the subluxation, when they stand up, they're going to be subluxated again. So we ask the body, what's the best posture to adjust a person in, and you adjust them. And that's why, one reason why you get such good results. I mean, I had one guy who was a guitarist. It only hurt when he was playing the guitar on stage. So he brought the guitar in, and he held it, and I checked him, and he was subluxated in that state. I cleared him out, by the way, before he held the guitar. He was totally clear. He picks up the guitar and holds it, and suddenly he's subluxated again. I adjusted him then. After that, he had no more problems on stage. And you can say same thing with golfers and left-handed. Or is it this way? Never mind. But golfers, you know, you can bring in the club or whatever. Go into the position. Tennis players, anything. Any position. Oh, well, it hurts me when I sleep on a certain way. Okay, lay them down, go into that position, and adjust them while they're in that posture. You check them and adjust them. So you check and adjust patients wherever they need it. And that is one of the reasons why, again, the adjustments are so long-lasting. I tell patients before they leave my office, I say, make it hurt. And they look at me like I'm crazy. I say, make something, you know, if they came in for pain, of course. Not everybody does. Make it hurt. And they think I'm crazy, but I wanted to bring out the subluxation. And then you check them and adjust them while the subluxation is revealing itself. So this is a vitalistic or an empirical technique. That's the beauty of it. It is not mechanistic. We're not telling the body what we think it should do. That is saying subluxations are only C1. Right? Only upper cervical, that's it. That's not life. That's not reality. We're asking the body. We're not saying we know better. We are humbly asking the body, reveal to me. So we are learning from the body what it wants. You know, we talk about innate. Well, let's use innate, not just in philosophy, but in real life, in working with patients. So we're asking what the body wants. We learn from the body from what it's telling us. Technically, it's called a posteriori. We're respecting the wisdom of the body and learning from it. So this is not mechanistic. We don't know what the body supposedly wants. We're not intellectually deciding what the body wants. Mechanism is also known as rationalism. And these are philosophical stances. Chiropractic is philosophically vitalistic or empirical. We learn from reality. We learn from the body. It is not mechanistic, where we're telling the body. Medicine is mechanistic. You know, well, we feel that this is the way the immune system works, and if we inject this into a kid, we believe that antibodies will produce that will make the kid healthy. That's a mechanistic model. Well, we believe the heart is like a pump and just plumbing, and if you have a clogged artery, take it out and replace it with another one. That's all it needs. That's mechanism. None of it works, but that's the medical model. As they say, MDs don't really care whether it works or not, just whether they understand the mechanism. It has been said. Whereas real healers, empiricists, homeopaths, chiropractors who are doing it right, say, well, the important thing is not necessarily knowing the mechanism, because we never really will ever know the mechanism in its totality, but whether or not we get the patient better. That's the most important thing, and we seem to have forgotten that in many areas. So our goal is to get the patient better. The mechanism will ultimately, possibly, I shouldn't say ultimately, possibly be discovered one day, but maybe not. Life is full of mysteries, and the more we try to understand, the deeper the mystery gets. That could be frustrating to an intellectual, but to others it might be the best part of it. It's fun.